Hello, and welcome to The Explainer. Today, we're going to pull back the curtain on something really profound, the hidden art of truly caring for another person. We're going to explore the skills that mix vigilance, empathy, and just deep respect, skills that really define what it means to care.
It's a question a lot of us will face at some point, right? Whether it's for a parent, a partner, or a friend. And it's so much more than just ticking off a list of tasks. It's about protecting someone's life and their spirit.
So here's how we're going to break it down. We'll start on the front lines, then dive into the core ideas of safety and dignity, touch on the crucial skill of observation, and then, tie it all together at the end. To really understand this, we're going to look at the work of certified nurse aides, or CNAs. These are the folks on the front lines day in and day out. And their legally required practices, they actually give us an amazing blueprint for compassionate care that honestly applies to all of us.
See, this kind of care isn't just guesswork. It's not about winging it. Every single person has a unique, detailed plan, a roadmap that lays out their specific needs, their goals, and what they prefer. And following that roadmap, it's not just a good idea, it's the law.
And that whole personalized plan is built on one absolute foundation: physical safety. Before you can even think about comfort or dignity, you have to make sure the person is safe from harm. That comes first, always.
Okay, so imagine this scene. It's high stakes, it's not about grabbing the fire extinguisher, it's not about calling 911, not at first. In the world of care, there is one and only one correct first move. Any ideas what it is?
Well, the answer is all wrapped up in this simple but brilliant acronym, RACE. And that very first step, R, stands for remove. You get the person out of danger's way before you do anything else. Only then do you move on to A for activate, C for confine, and E for extinguish. It just perfectly shows the number one priority. Their life comes first, period. Now, safety is also about protecting people from less obvious dangers. For example, the skin of an older person can be incredibly fragile. Shearing happens if you slide someone across a bed sheet instead of lifting them. The skin kind of sticks, but the body keeps moving, and it causes these painful tears that can get infected. It's totally preventable, but only if you know what you're doing.
And here's another huge safety risk: aspiration. This can happen if someone is fed while they're lying down. Food or liquid can go down the wrong tube, right into the lungs. A super simple action, like just making sure the head of the bed is raised up, that can be the difference between a safe meal and a life-threatening case of pneumonia.
Okay, so once a person is physically safe, the focus shifts to something that is just as vital: their dignity. And this is all about seeing them not as a patient, but as a whole person. Someone with a past, with rights, and with a voice that matters.
And we're not just talking about nice suggestions here. These are fundamental rights because a care facility is their home. So what does that mean? It means if a minister shows up to pray, you wait to take their vitals. If they want to be alone with their spouse, you give them that privacy. Their emotional and spiritual well-being is just as critical as their physical health.
Now, what do you do when someone's reality doesn't quite line up with our own? Imagine a resident says this, but you know her husband passed away many years ago. How do you respond to that with dignity?
This right here is the game changer. It's the huge difference between correcting someone and validating them. If you correct her, it's just going to cause confusion and distress. But if you validate, you step into her reality for a moment. You're not lying, you're connecting with the emotion behind her words, the love for her husband. That's what brings comfort. That's what upholds dignity.
And speaking of dignity, it's all about choice. If someone is on the schedule for a walk at 10, but they say no, you don't force it, you respect their autonomy. The best thing to do is negotiate. Hey, would you rather go for that walk a little later? It's a simple question, but it gives them back a sense of control. It reminds them their choices matter.
Okay, so to keep people safe and uphold their dignity, you need a third, absolutely crucial skill. I like to call it the art of observation. You have to be a bit of a detective.
So let's create a baseline. Picture this. Yesterday, a resident was totally their usual self. They were sharp, engaged, knew exactly where they were.
But then today, out of nowhere, they are terrified and completely confused. This is not just a bad day. A sudden shift in mental status like this is a red flag. It's a medical emergency. It could be a sign of something serious like an infection, and it has to be reported to a nurse, like right away.
For people who can't tell you what's wrong, you have to remember that every single behavior is a form of communication. A great caregiver learns to translate these signs. Someone rubbing their stomach isn't just fidgeting. It's a clue. Coughing every time they take a sip of water, that's a huge warning sign for aspiration. Good observation turns these little behaviors into life-saving information.
Let's take something really common, like low blood sugar. The signs can be subtle. As you can see here, we're talking about shakiness, weakness, and yep, that sudden confusion we just mentioned. Recognizing these symptoms and reporting them immediately means that person can get treated fast and avoid a serious medical crisis. It all comes back to just paying close attention.
So when you put it all together, this constant watchfulness for safety, this deep commitment to dignity, and this sharp eye for observation, what do you really have?
Well, it's something way more than just a job. It's a practice. It's a discipline. It's understanding that you're not just keeping a body alive, you're honoring a whole life. Every single action, whether it's unkinking a tube or just asking about a favorite song, is part of that practice.
And you know, in the end, these lessons from the front line, they're really for all of us. Care is just a fundamental part of being human. It's not just what we do for a living, it's about how we show up for the people we love. So the real question becomes, how will we choose to practice it?